So the O-belt grades of laminitis are four. So the first grade, when the horse is resting, it will sort of lift the feet at certain intervals just for a few seconds, but you don't see any lameness when they're walking. Now, grade two, the horse will move willingly, but the gait is sort of stilted. A foot can be lifted off the ground without difficulty. Now, three and four is where we're a bit worried. So the horse won't want to move at grade three and tries to resist lifting the foot off the ground. So even if you try, they'll be like, nope. And number four is where the horse refuses to move and will not even move even when they're forced. Now, about the grades I mentioned before, so these are clinical parameters. With grade three and four, you also have to consider RU parameters. So I think these are things like measurements clearly. So I'll just run through them quickly because I think it could come up. So palmar angle, let's say it will be about 5 degrees as opposed to double that in the second grade. Hornbone distance is about 20 for both, but like if you see a smaller number like around 15 and 25, 15 is obviously going to be grade one. So about the coronary band distance, it should be 14 to like 16, but of course 16 is the higher end. And the width of the sole and the wings of the bone, yeah, again, very similar. And soft tissue, you won't see any change in grade one, but this is very important. You'll see a thin lucent line in grade two. Grade three, so this is sort of the clinical parameters we mentioned before, and I assume we'll go through RU parameters as well. So the measurements we just mentioned, but for grade three and four. So hoof pain, it's heavy in grade three, but much more extreme, as we mentioned, because the horse isn't going to move. Gait, so yeah, they're not willing to move. Like they can't bear weight on 3 of their legs, so that's the majority, whereas grade 4 they literally are going to lie down, like they're not going to put weight on any legs. The horn wall, you'll see grooves and bruises, and you'll even see the coffin bone rotating or sinking in grade 4, and I imagine that's more of an x-ray thing. Now, yes, here we go. The RU parameters of grade 3 and 4, the palmar angle is greater than 15 for both, which is not what was mentioned before. The hornbone distance, it's not the same as grade 1 and 2, it's greater than that. The extensor process, so basically all the numbers we mentioned for grade 1 and 2, but like greater. Now with the sole width and the wings of the bone, you'll see elevated wings for grade 3, whereas you'll see, let's see, sinking in grade 4. Just take a good look at that. And for soft tissue, you'll see transparent lines in the front and underneath the coffin bone, whereas like, oh yeah, that's the same. So that's the same, sorry. Anyway, so this is just what it looks like in picture form. So grade 1 and 2, you'll see a radio opaque object has to be applied to the mid-dorsal wall just to understand, okay, that's the lining of the hoof. Yeah, in grade 3 and 4, you can see like there's degradation of the hoof wall there. And I'm just going back just to show you again, so you can see the angles changing over time. Anyway, so when we're treating the acute stage, so as we said, this is where we start to see issues with locomotion. You have to cool the limbs because, of course, they're very hot, and part of this is also because of inflammation, so NSAIDs are necessary. A lot of it is symptomatic therapy. You only want drugs to increase the laminar blood flow because we mentioned like the capillary collapse is one of the reasons we get laminitis. So like acepromazine, and here are just some examples like nitroglycerine paste, and low molecular weight heparin. There's also styrofoam insulation, so covering the whole thing in styrofoam, and of course resting the horse in a box as well. And when it comes to hoof care, of course we mentioned all this stuff about inflammation, but there are 2 main objectives. We need to redistribute the weight, because sometimes we get laminitis because we put too much weight on a perfectly healthy hoof that now has restricted blood flow. So we recruit the frog, bars in all parts of the sole to bear weight. So we basically remove the shoes and place the horse on a sand bedding, so it's quite soft, and you can also use a pad system under the frog. So yes, redistribute the force of the weight bearing. The second objective is to decrease the tension in the digital dorsal. I'm so sorry, I don't know what this is. Try and find that out. And the tension in the dorsal laminae by basically elevating the heel. So imagine the hoof is flat, this part, elevating that. And by moving the point of the palmar to the dorsal margin of the toe. Now with the chronic stage, the treatment goals are 3. Of course, pain control, that's a pretty main one. Maintaining the stability of the distal phalanx, because remember, in the chronic stage, it can actually move through the hoof wall, and to restore the relationship between the hoof capsule and the distal phalanx. So we'll use vasodilators, I assume, to reduce blood pressure there, do a tenotomy of the DDFT. I assume this is bone then. The hoof wall and sole surgery. So if you are asked about surgeries, these are the treatments. And of course, trimming and shoeing the foot. Like sometimes the shape also doesn't help. And also, when you trim the foot as well, you have to decide whether or not to shoe the horse, because sometimes, as we said, you put them on sand bedding and things like that and remove the shoe because it doesn't help. So it's very much individually based. And remember, the same horse can have different problems in all of their feet. So I'm just going to stop here and we'll carry on soon.